Okay, welcome back. What I want to look at is continue with health and safety. Now, all I'm going to do, I'm going to go through this in a manner. Now, we're going to look at health and safety in regards to the Health and Safety at Work Act 1974. Now, some of you would have had a lot of this information already, but for those of you who are doing the new 5357, you may not realize that the information you may already have will suffice. But remember, you need to write it up and present it in your own manner and in your own words, okay? So briefly, just section 2, just of employers to employees, okay? Now, I'm not going to read it out to you in full. I'm just going to take them as an extract, okay? To ensure so far as reasonably practicable the health and safety and welfare of employees in particular. Safe plant, safe use, provision of information, safe place of work, safe working environment, committees where there are recognized trade unions, a written safety policy, and you have more than 5 employees. Okay. Let me just go back to make sure that we get this in as it should be. Let me just move in so we can get it fully on screen. Okay. Okay, and now pan back a little bit more so we can get it fully on screen. Now, this is information that you will need to complete your relevant units in regards to whether you're doing the 2357 or the 5357. You'll still need the same information and the same knowledge, okay? The 2357 would be unit 301. In the 5357, it's now unit 101 or 001. Okay. Okay. Section 3, duties of employers to others affected by their undertaking. Okay. And here you have their duties, okay, of employers. A duty to safeguard those not in their employment, to include members of the public, contractors, patients, etc., etc. Okay. We'll just go back and we can make sure that I get this in full for you, okay, because you will need this information yourselves. Just make sure we can get it in full screen. Okay. Okay. And here we have section 7, duties of employees. Now, you as an employee also has a responsibility to the place where you work. And you have a responsibility not only to the people you're working with, but to those people who are working around you. Okay? So you might have bricklayers, you might have plumbers, you might have roofers, slaters or plasterers, etc. Those are the people you also need to bear in mind that you have a responsibility to. Okay? Two main duties are to take reasonable care for the health and safety of themselves and others, to cooperate with the employer and others to enable them to fulfill their legal obligations. Okay, so it is not something you can do because you feel like it. It's something you have to do because it is the legal requirements. Okay, let me just pan back to make sure I get this in view, full view. Okay. Okay, good. Section 8, okay? And again, bear in mind these sections may have changed, so take into account that any changes which may have been rewritten. So you need to look at the Health and Safety at Work Act as it is for 2019, 2020, okay? And take into account that we are leaving the EU, so we don't know what changes, excuse me, may yet come about, okay? No personal misuse interfere with safety provisions, okay? Let me just go back and make sure that we get that in view, okay? Full in view, okay, yes. Okay, good. Okay, section 9. Employees cannot be charged for health and safety, etc. Okay. Let me just go back to that so we make sure you can be aware of that. Okay. Section 1.12.1. Management of Health and Safety at Work Regulations 1999. Now you will look this up on the HSE website, Health and Safety Executive website, and if you look this up on the Health and Safety Executive website, it'll give you the latest information that they have and bring you right up to date. Now make sure that this reference section still applies because it may have changed. Okay, so again, check for changes, look up any information that you may need, check again. Okay. Employers must let me just put that for you, undertake suitable and sufficient written risk assessment, put in place effective arrangements for planning of health and safety measures in the workplace, employ or contract competent persons, develop suitable emergency procedures, so if there's a fire you know where to meet and can apply them, provide HNS information to employees and others, the employees who are sharing the same workplace and the parents of child employees or those on work placement, corporate and health and safety matters, provide employees with adequate and relevant HNS training, provide temporary workers and their contract agency with appropriate HNS information, protect new and expectant mothers and young persons from particular risks. Under certain circumstances, provide health surveillance, meaning that you can be monitored or be on camera to ensure that you have carried out the work and the health and safety requirements as you were told it should be done. Okay. Let me just go back, make sure we get all this in place. Let me just pan back for you. Okay. Now remember, you can pause the videos as well so you can see the information for yourselves. Okay. Okay. Now, management of health and safety at work has become a major part of health and safety in the workplace these days now. And bear in mind also, look at the specifications now, even more so now in regards to COVID-19. And you're going to probably find that there's going to be amendments made to the Health and Safety at Work Act 1974 to take into account the situation we have experienced in March 2020 in regards to COVID-19. So keep an eye open for that and make sure that you are compliant with those or any new regulations. Risk identified by risk assessment, okay, etc. Sharing the same workplace, the preventative and protective measures that are in place, okay. arrangement and procedures, and the names of those responsible for the implementation of the procedures. Okay, and let me just make sure that you have got this. Let me pan back a bit to make sure you can get it in all in. Okay. Okay. Okay, good. And here's your key elements. What? Statement of intent. Who? Organization. How? Arrangements. Policy of intent should contain the aims. Now here you can read this for yourselves. Okay, I'm not going to look at trying to read this to you, because you can do that for yourself, I'm sure. Okay. So let's just make sure that it's readable. Okay, and it is sorry, I'm just trying to make sure I can get it all in. Okay. Okay. All right. Yes. Turn back a little bit. Okay. Now you can read this for yourself. I'm not going to read it. Setting targets, etc. Okay. Training and education plans. Health and surveillance, occupations health. Safety inspections. Improvements. Near miss and incident recording. Risk assessment conducted. Reduction in numbers of accidents. Now remember, if you have a reduction in that number of accidents, it means that your workplace becomes more productive. Okay, so bear that in mind. It becomes highly productive. Okay. Okay, pan back a bit, make sure we get it all in. Okay. Okay, comparisons. Managers' responsibilities for setting policies. Okay, etc. And again, here you don't need me to read this out to you. You can see this for yourselves. Okay. And I'm going to make sure you get this in view. Okay, so let's make sure we can pan back. Okay, now again here, no need for me to read this. It's quite clear. And the organization structure identifies individuals who take on specific duties. And some of you may well become health and safety officers in due course. It's a very worthwhile job. Okay. And again here, I'm not going to need to read this out to you. You can read this for yourselves, okay? And let me just go and make sure that we can get this in full, okay? Okay. And again, remember, you can pause the videos yourselves, okay? And you don't need me, let me just go back to that. Make sure I can get it all in view for you, okay? No point doing it if you can't read it or cannot see to read it, okay? And just to make sure we can pan out and we get in view, okay? Good. Now here we have general arrangements, specific arrangements, allocating resources, use of equipment, planning, controlling hazards, consultation, inspection, competence and training, etc. Okay? And these are your general arrangements that you make to ensure good health and safety is employed in your place of work or in your company. Okay? Just go back, make sure that it's all kind of in view. Okay. Okay. Now, what I'll be asking here is, why do some companies fail the health and safety inspection? Okay. Is that no company should actually fail it, because if you appoint the right people, making sure that you've provided them with the adequate resources to complete their task, your company should not have any problems. And lack of commitment, okay? Poor communications, unclear policy. They haven't structured the policy in a manner that is effective for their company, and they have not looked at how other companies may have done theirs so that they can learn from someone else's experience. Okay. Resources aren't provided. In short term, they're not providing any money to ensure proper health and safety has been implemented. And then they end up spending maybe £200,000 in a fine, or possibly being prosecuted. Okay. Unrealistic targets, too much emphasis on rules, okay? High labor turnover, okay? Meaning to say that they don't keep their workforce that long. Because, again, quite possibly because of poor health and safety implementations. Okay? Okay? Now, again, this is down to you to make sure if you find something unsafe, report it. Make sure you put it in your accident report book or recorded book. Bring it to the attention of your foreman or your supervisor, whoever. Okay? Don't be afraid to, because health and safety is a legal requirement, and any company failing to comply with that law can be prosecuted. Bear that in mind. Okay, thank you for your time. I hope you found this useful. Okay, have a good day. Bye bye.